Hello, welcome to the Vanderbilt Online Guide for Children's Health, brought to you by the Monroe Carroll Jr. Children's Hospital at Vanderbilt. The following presentation outlines how to develop and implement an effective healthy school team. After completing this presentation, you should understand why a healthy school team is central to the coordinated school health programming. You should be able to identify members to recruit to your healthy school team, understand the steps involved in developing your healthy school team, as well as understanding the activities required of the team. Lastly, you will learn the resources and tools available to help your school implement its own healthy school team. A healthy school team is really in place to oversee the coordinated school health program. They're going to be the ones that drive the efforts and really examine what programs are in place, what the strengths and weaknesses are from a health standpoint in school, as well as to find gaps where programs and services are missing. No one person can and should be tasked with this role. Oftentimes, principals and school officials will look at physical education or health education teachers to drive the health efforts, but are really unsuccessful because of the lack of buy-in from the rest of the school and the community. Healthy school teams are in place to build a collaborative effort among the school, the parents, and the community, and are vital to the success of the coordinated school health program because of their collaborative nature and their ability to facilitate programming. Who you choose on your team will really dictate the success of your coordinated school health program. You really want to try to find teachers, staff, parents, and community members who are committed to making the school as healthy as it can be. You want to aim for diversity. Balancing the type of members you have will avoid having the majority of your representation from any one single component of coordinated school health. Of course, if you have 100% health education or PE teachers, they're going to be driven from that sort of standpoint. Same goes if you think about like bringing on the cafeteria manager or having the nutrition services run the program. It's going to be all driven toward what kinds of foods are placed in the cafeteria, and you may forget some of the other aspects of that. So when thinking about putting together your staff for your healthy school team, think about bringing in somebody from each of the components, from health services, health education, nutrition services, your counseling, psychological and social services, your PE, your staff wellness, your family and community involvement, as well as your healthy school environments. Thinking about school nurses, maybe cafeteria managers, psychologists, PE teachers, coaches, even right down to the bus drivers. What can the bus drivers do to help make your students in your school a healthier place? Once you have made the commitment to coordinated school health and have started to identify some team members for your healthy school team, it's time to start putting them together in some sort of worksheet. Please take a few minutes to download the Healthy Team Identifier worksheet and begin to brainstorm some of the potential members of your school community that you may want to recruit on your healthy school team. Think about each of the 8 components like we talked about in the previous slide. Make sure you note some of the stakeholders that may be involved as well as some community members and multiple coordinated school health components. For example, school nurses may mainly be responsible for providing health services, but they may be more than willing to help in areas such as nutrition services, maybe employee wellness, or even physical education and physical activity. As you begin to identify those healthy school team members, make sure you write down their name, obviously, and then maybe what components that they might be good for. You can even think about other strengths and weaknesses that they might be able to contribute to your healthy school team. Maybe they're not part of one coordinated school health component, but maybe they're there to maybe bring in extra community members, drive fundraising efforts, and things like that. You don't necessarily have to have them as part of a coordinated school health component, but just as a vital part of your team. Once you're finished with that, return back to the presentation. As with many teams, you're really going to want to establish leadership roles within the community to guide meetings, coordinate member activities, or even serve as liaisons to the greater school community. Some potential roles might include team leaders, secretaries, external affairs liaison, internal affairs liaisons, or even public relations heads. The team leader is going to be in charge of conducting team meetings, maybe setting the agenda or establishing an agenda that's put forth by the committee, and overseeing team activities. The secretary is going to be responsible for communicating the meeting information, taking meeting minutes, and also distributing major decisions to the team members. An external affairs liaison is responsible for reaching out to the school community, to gain support and resources. The internal affairs liaison serves as the contact between the members of the team, and the public relations head is responsible for promoting the activities and initiatives created by the Healthy School Team. As a whole, the responsibilities of the Healthy School Team may include analyzing current school environment to identify health problems and concerns, maybe determining which of these health problems takes precedence, and lastly, designing solutions to these identified problems. You can create an effective Healthy School Team by following some of these guidelines that we have put together for you here. As we previously discussed, the first step is to identify key stakeholders and create a team that's full of members that are committed to the cause. They're committed to making the school as healthy as it can be. Second is to really evaluate your school's current health environment in order to identify the problems and concerns that are specific to your school. You may want to also think about looking at some other schools that are similar in size and general makeup of its student body, and try to see what concerns or issues may have arisen there to kind of predict some of the outcomes that you might face. After the team has identified the school's areas of health concerns, you're going to want to determine which problems need to be addressed immediately and which problems can be put on the back burner per se. The third step is to set the school health priorities and goals. Once you've decided which problems it will address, the fourth step is to identify school resources and design solutions, followed by managing and monitoring the implementation of the solution or the initiative. Lastly, you really want to make sure to celebrate and recognize successes. It's really important to do this, really to raise community awareness as well as team member self-esteem and satisfaction. The first step in developing your Healthy School Team is to actually put together a team. In creating your team, you really should gain support from the school administration. The first thing we did when we went into schools before we even developed the Healthy School Team was to seek the approval from the principal, as well as to get their input on what faculty, staff, and maybe even students they'd like to see involved in the Healthy School Team. Not only is the administration approval often required, but gaining endorsement from the leaders of your school can really help encourage others to join as well. Once the staff at the school knows that the principals are bought in and that the school administration is fully on board, they're more likely to commit on a greater scale. Once you've secured the commitment of the team members, you'll really want to establish individual roles and determine team norms and operational guidelines. After creating your Healthy School Team, it's time to get down to business. In order to design a health programming, it's necessary to identify the health issues concerning your students, staff, and families. There are 3 tools that can help you along your way when you're thinking about your school's health environment. The first is the School Health Index, and it's a tool put together by the CDC that helps you examine all the aspects of your school as they relate to the 8 components of coordinated school health. The second is the Youth Risk Behavior Surveillance Survey, which is often conducted by your local health department, or it may be something that you want to conduct in your own school if they haven't done so already. And lastly is the School Guidelines to Promote Healthy Eating and Physical Activity. You can visit the links of these by just copying and pasting or just typing in these links to your browser. The following is a screenshot of the School Health Index. You'll see at the top Module 1, School Health and Safety Policies and Environment. The School Health Index is a tool that schools can use to improve their health and safety policies and initiatives. It aids schools in identifying the strengths and weaknesses of its current health environment, and additionally it helps them to create plans to improve upon these identified areas. Later on, we're going to start posting trainings about how to effectively utilize the School Health Index, how to conduct the School Health Index, and how to interpret the results. When you're thinking about creating a healthy school team, you're really going to want to split up the School Health Index among those who can really take on the 8 components. And we'll talk about this a little bit more in detail in the training. Here's a screenshot of the Centers for Disease Control and Prevention's Youth Risk Behavior Surveillance System, which is a national school-based survey conducted by the CDC to help monitor the health risks and behaviors associated with the youth. A lot of times they'll provide some really good information as to what the youth in your area might be doing as far as behaviors that contribute to unintentional injuries, sexual behaviors that may lead to sexually transmitted diseases, including HIV infections, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and even inadequate physical activity. I believe that there are some tools on there as well that may allow you to dig deeper and conduct a survey similar to this in your own school to find out what's going on amongst your students. For more information, be sure to check out the website. It's just under the Centers for Disease Control and Prevention, cdc.org. The next screenshot that you're going to see are the school guidelines. These school guidelines to promote healthy eating and physical activity are the result of CDC research. It provides 9 guidelines which summarize basically the best practices related to promoting healthy eating and physical activity in schools. Once you have identified your school's areas of concern, you're going to want to determine which issues to prioritize. The following list should give you some factors to consider when deciding which health issues you should prioritize. Prioritize those issues which are most important to your school and its stakeholders. You really want to put stakeholder thoughts into consideration. Identify which goals are really feasible for your school to accomplish. Sometimes it's better to achieve smaller goals first and then reach for bigger goals. You're going to build confidence and you're going to build momentum going forward. Identify which goals are not yet attainable, and then categorize goals to long-term and short-term. Like I said, you may want to tackle the short-term goals first to build momentum to tackle those long-term goals. One example, you may have identified unhealthy school cafeteria food as a major problem. However, when you're addressing the issue, it may not be feasible if you're lacking the funding, the legislation, or any support that you need to make changes. Therefore, you really should work towards addressing the identified need. It may not be the top priority for your school. Instead, your school may decide to focus on creating a bullying prevention program because you currently have the resources that you need to support and to build that program. Before you decide on a course of action, make sure you take the time to assess what health resources may be readily available to your school. Look up your district's wellness policy, which should be posted in the food and nutrition section of the district website. For Metro and Nashville Public Schools, it's directly posted under a wellness policy part of their website. Contact your school board for support. They may have some contacts that can help you out in achieving some of your goals. Identify community partners and resources that may be willing to offer their services, as well as identify current health and wellness resources and policies that are important to avoid duplicating existing programs or services in your school and community. We're lucky here in Tennessee that coordinated school health is part of a mandate that's continually funded by the state each year. And there are a number of resources in Nashville that can really help you to support your school health team in developing coordinated school health programs. So please take a look at the links that I've provided here, and if you have any questions, that I'm sure that Sarah Smith or Rebecca Johns-Womack would be happy to answer, or you can contact our offices here at the Children's Hospital. So once you've completed your school health index, you're going to get some results back. You're going using the results of your school health assessment. It's best to develop an action plan for your school. It's important to think about both short-term and long-term health goals. Define some specific activities that are going to be necessary to complete your action plan. It is often easier to complete a larger task if you break the work down into smaller, more manageable steps. Like I said earlier, the more you complete those small steps, the more momentum you're going to build and the more likely you're going to complete your larger goal. Assign some of those individual specific tasks and ensure that whoever gets those tasks have a clear understanding of their responsibilities. You're going to want to set a timetable for the actions to be completed and monitor the progress as you go on. If you don't set a time for those actions, the less likely you're going to be to have those actions completed. And finally, promote these new initiatives to students, parents, and other school staff and the community through health campaigns, teacher meetings, or even special events. If you have a school garden or if you're promoting local food, make sure that you highlight some of the food from the garden, or highlight some of the food that you are promoting. Implementing your solutions is going to require the proper management. You're going to want to maintain a high level of communication among all the members that are participating in your Healthy School team or that you've assigned tasks to. Um, Try to meet regularly as a group. Our recommendation is meeting on a bi-weekly basis, but a lot of times you'll have Healthy School team members that meet on a monthly or even on a quarterly basis. As long as you're communicating openly in between those meetings, it's okay to spread out your meetings regularly. Hold regular check-ins with individual team members to assess their progress on specific assignments. Like I said, if you're going to host quarterly meetings or even once a year meetings, you're going to want to make sure that you check in regularly. Delegate the tasks, but don't dump. Make sure you define the responsibilities, provide clear guidelines and expectations for the work, monitor the progress, and provide feedback. If you're not willing to take on the task yourself, though, nobody else on your team is going to want to either. So you're going to want to make sure that you take on some of the responsibilities. And finally, revisit your action plan to monitor your progress and make sure that you're completing your goals in a timely manner. It's important to critically evaluate your program regularly to determine its strengths and areas for improvement. You want to make sure that you catch any problems early so that you can fix them right away and make sure that your program is completed successfully. Make sure that you market your success. Send a newsletter home to your teachers and parents, letting them know the progress of your program. Also, host a health event showcasing any new initiatives or things that you might be doing, such as food grown in the school garden, maybe new cafeteria menus, or even healthy campaigns. Display student work, art, essays, or projects related to health promotion. Recognize key students, faculty, and parents who have made the progress possible. By bringing attention to their efforts, it's going to let them know that their efforts are appreciated and that it's going to make them want to continue to participate. Finally, publicize the benefits of your healthy school environments to students' achievement to raise teacher, community, and government awareness of their role in supporting the coordinated school health program. Basically, what you're doing here is you're kind of bragging about what all the successes that you've had and letting people know that you're starting to see successes, so that the momentum carries on in the future. Alright, so let's review the process for establishing your Healthy School team. The first thing you want to do is assemble the team. This involves determining who's going to be the best fit for your Healthy School team and thinking about those 8 components, who's going to fit in which place. Next, we're going to identify the problem and collect data to assess the needs of the school. So making sure that as you move forward, you're always thinking about the problems or the goals that you want to put forth when starting to come up with solutions. Third, we're going to develop an action plan based solely on those needs. Like I said, from here forward, you're going to want to make sure that you're thinking about the greater goals that you have in mind and how we can accomplish those goals. Next, we're going to implement the action plan. That's putting everything forward, making sure that you're doing what you said you were going to do. So starting to get everything on the ground and going. And finally, you're going to evaluate your outcomes, revise your plan, and determine your next steps. You may have been successful and can find areas where you can duplicate programs for other health problems. And in some cases, you may find some weaknesses or some mistakes that you made, and you can correct for those mistakes and go right back at it. As we said earlier, a Healthy School team assists with the establishment of the Coordinated School Health Program. However, it provides a lot more benefits to the school as well. First, you take action against the school health issues, and it really puts a team together to tackle those problems. Next, it acquires tools and data, such as the School Health Index and the YRBSS. It at the very least, lets you know where you stand within your own school, and perhaps even within the district. It gives you a starting point, a point to move forward from. Next, it develops programs and solutions tailored to the specific needs of the school and its populations. In other words, it makes a program that is specific to your school. It's not cookie cutter and coming from a school that may not have any of the same needs that you do. And finally, it increases internal capacity of the school and of the community to create and sustain change. So you're giving your self the power to make these changes internally and carrying the momentum forward. So now we're going to review some of the things that we've covered. Try not to look at the screen while I ask you some of these questions, and write down your responses, and then come back and check out to see if you got the responses right. You can go ahead and pause it after I've asked the 3 questions and then come back and see. First, list the 5 major steps to a healthy school team development process. Next, name one tool that can aid the healthy school team in accessing the health needs of school or developing solutions. And finally, name 4 major stakeholders that should be included in your healthy school team. As you'll see here are a few additional resources and some links that can help to not only provide you with more information regarding coordinated school health, but also inspire you to take further action. To kind of wrap things up and bring everything to a conclusion, here's some takeaways from the presentation that you just watched. First, a healthy school team is vital to the success of coordinated school health programming. This couldn't be more true. The healthy school team really drives everything that you do from a health standpoint and brings it to the forefront. Second, teams should include stakeholders from all 8 coordinated school health components. You don't want to put all the burden on just one person. You want to make sure that there's somebody represented from each of those components and that you bring a roundabout point of view. Finally, the activities to include are identifying the school health problems, setting your priorities. Thank you for joining us in the Vanderbilt Online Guide to Children's Health and the presentation of the Healthy School Teams. We hope that the information that was provided today is useful and that you'll take it back with you and begin to build your own healthy school team. If you have any questions, you'll see on the last slide that our contact information is there. Please feel free to contact us and hope that you have much success moving forward.